Welcome to the Talk to Tom show. Talk to Tom. 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 Try saying that fast 15 times. Hey, let's go. Hey, Doc, fill me in on stress fractures. Okay, Doc, I got two dirty words for you today. Stress fracture. When an athlete hears that, it's just like the kiss of death. They know it's an automatic 4 to 6 weeks, 8 weeks of downtime. Talk to me about stress fractures.
What a stress fracture is anytime there's an excessive force on a bone, whether it's from running, jumping, hitting, anything that puts an extra force on the bone that's higher than what the bone can withstand, it actually cracks. If you've heard the word hairline fracture, that's basically what a stress fracture is. It's fatigued the bone to the point where it cracks. Once it cracks, you're at risk for it breaking further through. One of the things you're going to experience is severe pain. Every time you try to increase the load on that joint, it starts to hurt even more. In runners, bikers, swimmers, anybody can get it from repetitive load, but more commonly I see it in runners. The pain is going to be anywhere where that load might have been too high, whether it's in the hip, in the thigh, the knee, the ankle. Those are probably the most common places that I see it. It's important to get a diagnosis, so if you have pain that doesn't go away with any of the routine things that we've talked about trying, such as stretching, rest, anti-inflammatories, come see a doctor and get an x-ray. That's the first line of how we find out if you have it. Once you've got it, we've got to be very careful in how we treat it because we don't want it to worsen. The biggest thing I'm going to have you do is keep your weight off of it. We're going to have to stop and curtail your running program. You can still cross-train with some other activities, but impact is not going to be one of them. The timing for that bone to heal depends on where it is. In the hip, it's a larger bone. There are much more dangerous things that can happen if that stress fracture doesn't heal. It's going to be a little bit longer. We'll keep your weight off of it than, say, if it were at an ankle.
Age. Is age going to play a role in my recovery time? Now that I've turned 50, it's like, oh, you've turned 50. Everything starts to fall apart. Does a stress fracture at 25 heal differently than a stress fracture at 50?
Heals about the same, and it's important to find out some other risk factors for it. Sometimes the fracture can just be you trained too hard, you overtrained, you started too quickly, didn't ramp up properly, and that's where that fatigue fracture comes from. But it can also be, and we see this sometimes in female runners who have irregular periods, their bones may be weaker and they develop osteoporosis. That can make them have a stress fracture at an earlier time with even less of a stress. So the age isn't necessarily a factor in how you heal or what may have caused it in the first place.
Once that stress fracture heals, should that athlete be concerned with it's coming back at that same spot again, or does it heal stronger? Is it an efficient healing on a stress fracture?
If you give it the appropriate time, it usually is an efficient healing so that you can go back to that activity. But obviously, the strain that you had that started it, you have to modify. So you're not going to ramp back up as quickly as you did before. You may have to choose a different running surface, a different type of activity to build back up before you go back to that sport because you don't want to have the same kind of injury.
So when somebody comes into your office, men, women, who's more likely to be in the office? Does it make any difference?
I've seen both. So anytime you have pain, there may be swelling associated with it. You tell me every time that it happens, you get swelling and pain, and it's always when there's impact. I want to know about it. I'm going to get an x-ray. You may need an MRI. You may need a bone scan. We've got to get a diagnosis first because it's so important to keep your weight and stop that fatigue on it, stop the stress, and that's what allows it to heal.
Thanks, Doc. Next time, we're going to talk about two dirty words, plantar fasciitis. We'll see you next time.
For more information, call 214-496-9700 or go to www.eliteortholascalinas.com.
Out of the Blue Media. Creativity, personal attention, never stop.